For Global Medical News Network, I'm Heidi Spleet, reporting from the annual European Congress of Rheumatology in Rome, Italy. The 2010 ACR-EULAR criteria performed well in all subgroups of rheumatoid arthritis patients. The new ACR-EULAR criteria are easy to use in clinical practice, according to Dr. Selena Alves. What makes the new ACR-EULAR criteria different from previous diagnostic criteria?
The difference is mainly in that the new criteria set is specifically developed to identify patients that are at risk for developing RA, and they did this by a data-driven aspect or phase and by a consensus-driven phase in making or developing the diagnostic model. And this ensures that features such as anti-CCP are included in the new criteria set, but also that features that are more compatible with long-standing RAs, such as rheumatoid nodules that are included in the old criteria set of the ACR, the 1987 criteria set, are no longer in the criteria set. And this ensures that patients with early disease can be recognized while still being able to diagnose patients with long-standing RA.
How do you think that the new criteria will improve patient care?
I think they will improve patient care because we now have the ability in using the new criteria to diagnose patients earlier on in the disease course, and thus to start treatment earlier on in the disease course, and hopefully we will be able to prevent the chronic erosive state that we know as RA, specifically RA according to the 1987 criteria. So hopefully in a few years we will not see patients that develop erosions anymore.
What should rheumatologists keep in mind in order to use the new criteria effectively?
I think they should know two things. The first being, if you look at what we've done in our cohort in the validation study, we've seen that the criteria are very specific, so there's a low chance of having false positive results, and thus using the criteria you have a low chance of treating patients that should not have been treated. Also, the presentation by Daniel Elataha earlier this week, he said that you should keep in mind that if patients do not yet classify according to the new ACR-EULAR criteria, still they might classify in the future. So if there's still a reasonable doubt in your mind, there's no reason why you shouldn't apply them again later on in the disease course of the patient, and they might still fulfill the criteria.
For Global Medical News Network, I'm Heidi Spleet.